Coming up, an experienced motocross rider fights for his life after a major accident.
I'm going to put a chest tube in. Chest drain.
You want to put a chest drain in? Okay.
A woman has fallen from her mountain bike, potentially rupturing her pelvis.
Pains remain 10 out of 10.
Slowly.
And a rally car driver is trapped in his vehicle after hitting a tree.
He's just taken a big hit right on his right rib cage above his liver, and he's a bit sore there.
In Code 1. It's early afternoon, and the crew of Code 1 are responding to a life-or-death emergency.
Westpac 2 will be airborne 1 minute for Takopuru region, 5POB ETA 30, 30 minutes, thanks.
Advanced paramedic Rob Gemmell received the call.
A male in his 40s who's come off a bike, whether it's a motocross bike or four-wheel bike, on the beach, we don't know, but it's suggested of high mechanism.
45-year-old Todd Mullender is suffering from a severe chest injury after flipping his bike. He is believed to have major issues with his airway, a sign of broken ribs. Due to the remoteness of the area, no emergency service vehicles are at the scene. 35 minutes flying time north of Auckland into Korpuru. Paramedic Rob Gemmell knows to expect the worst.
From what I've encountered with these sorts of jobs in the past, it could be anything from traumatic brain injury, multi-system trauma, including the chest, abdo, pelvis, or isolated extremity injuries, or a combination of all of that.
We're heading southbound down the beach now.
Yep, roger that.
We should be able to see them soon. See them on the one there? Is that somebody on the one on the beach?
Yeah, I see the lights now.
Yep. Westpac 2, we have you sighted, thank you. Right door's coming back.
Ambulance Westpac 2 now landing.
Fire under. 4, 3, 2, 1. You're clear to ground. Landing deadly.
Rob's off com. Roger.
Upon arrival, the team are faced with a patient that is in immense pain with trouble breathing.
What's the situation we got?
This is Todd.
Yep.
Okay, he was on a motorbike, he did a flip.
Yep.
He has tumbled.
Okay.
He's complaining of a sore shoulder over here.
Yep.
And sore ribs. He's had 3 mgs of morphine and 4 of ondansetron.
Okay.
And he's still in a lot of pain.
Yeah. I think we'd probably put the collar on and get him down in his back, and we can see where we're at. I'm Rob, I'm with the doctor here, okay? It's pretty tough for us to check you out when you're in this position here, okay? Yeah. Are you having any troubles breathing right now? You are, hey?
Were you the first one to him?
Me and Dale was
Cool.
over there.
Was he talking to you when you guys arrived?
Yeah, he
So
was.
he's
He was
conscious?
talking, but he was out of breath.
Yep. Okay. All right.
Looks like he's come off a quad bike and rolled a couple times. Concerned he's got maybe a head injury and injury to his chest as well. So right now we're just trying to get his pain better and reposition him so we can have a better look at him on the stretcher.
Is that still in the chest?
No, shoulder.
In your right shoulder?
Okay, we'll put some...
Shoulder. What do you want?
Well done.
Good man.
Okay, where are you having pain right now?
Right here.
Right here, eh? Okay, does this hurt when I press it? Does that hurt there?
No.
Does this hurt in here?
I can't breathe.
Can't breathe, eh? I got another 5 of ketamine here.
It's a wedding anniversary today.
No, seriously. Oh, congratulations. How many years?
12.
12. Well done.
I'm just using the ultrasound here to have a look at this gentleman's chest.
What the doctor's trying to determine is whether he has a collapsed lung on the right-hand side, okay? If he does have a collapsed lung, then what we might end up doing is putting a needle in his chest to try and drain the air out of his chest, okay?
In Mission 2, the team have been called out to a woman in desperate need of their help.
All right, so we're in case now. There's 2 ambulances on scene. They've LZ set up in a paddock where the ambulances are. So
okay.
hopefully that GPS location will take us straight there.
46-year-old Rosemary is suffering from serious injuries after coming off her mountain bike. 15 minutes flying time southeast of Auckland in Waitakaruru.
ETA, sorry, 13 minutes 12.
Yeah, that's about right.
We've been tasked by ambulance to go to Waitakaruru, where a female in her 40s has come off her mountain bike. The only information we've got so far apart from that is she's been classed as status 2, so that's with possible serious injuries. And we'll find out further what those are when we arrive.
Cabin is secure, clear door.
Yeah, mate.
Right, coming back. Thanks.
Paramedic Ross Aitken and Dr. David Lang waste no time in getting to the ambulance and making a prognosis.
This is Rosemary. She's a below knee amputation 12 years ago, and she's had a prosthesis on. She needed to get on her bike and fell over, landing on her hip. It felt as if it had come loose, as it were. She thought the prosthesis had fallen off, which it hasn't. Pains remain 10 out of 10.
Rosemary, can you show me where the main pain is? Is it right up into your hip?
Rosemary is showing signs of a possible pelvic injury after falling from her bike. It is unknown how severe her injury is due to the awkward positioning of her leg.
That's another 20 of fentanyl and 5 of morphine. And that hopefully will just take the edge off to get the leg in a better position. Slowly, slowly.
The drugs aren't working. Rosemary is in a lot of agony after several doses of medication.
Still in pain, so I'm going to give her another lot of morphine.
The doctors will be unable to make a proper assessment until her pain is under control. 46-year-old Rosemary has had a severe mountain bike accident, rendering her immobile with intense pain spasms. The team must get her pain under control in order to perform a delicate procedure.
So we're going to get ready for our block. Another 20 of ketamine going in now. So that's going to take us to 60 of ketamine. Doesn't really matter. That one's got the blood pressure one on, which is going to be a bit of a pain. And we are done. So block is in.
This lady's had a fall off a bike and has injured her hip. We're not entirely sure what injury she's done, but she does have a deformity to the hip. She's in a lot of pain, and despite having a large amount of opiates that the original crew has given her, hasn't been effective. So we've given her further medication to essentially take her away from the pain. That still has been less effective than we would like. So she's also had a nerve block put in by the doctor. That should hopefully start kicking in the next few minutes.
While the crew wait for the block to kick in, they decide to drive her closer to the helicopter.
So there is going to be some gentle bumps as we drive.
Southwest of Dargaville, 45-year-old Todd Mullender and his wife Nairi were enjoying their 12th year anniversary when Todd suffered a serious injury after his quad bike rolled on top of him. Veteran paramedic Rob Gemmell fears he may have a collapsed lung.
There's got decreased lung sounds on the right-hand side. And what we really need to make sure is that he doesn't have the air in his chest. If he does, then this is something we want to do before we go, as opposed to having to do it when we're in flight, because it's not an overly nice procedure.
Suddenly, Dr. Rob Gooch makes the call. His lungs are failing.
I'm going to put a chest tube in. Chest drain.
You want to put a chest drain in? Okay.
A collapsed lung. There is air trapped inside of Todd's chest cavity, which is making it difficult to breathe.
On 1, 2, 3, up.
But before they can transfer Todd, Dr. Rob will have to surgically intervene. If he doesn't, Todd won't make it.
We're going to have to do a little bit of work on the side of your chest here. I'm going to give another 10 of ketamine.
Chest drain kit.
This is a difficult time for Todd's wife, Nairi, who watches on helplessly.
Will you be able to give him some more pain relief?
We're continuing to give him pain relief. We don't want to give him.
In the drug.
Yeah, we don't want to give him heaps and heaps all in one go because we don't want him to go completely unconscious and lose his breathing reflex. So we give him little bits at a time, and it's enough to sort of just keep him topped up as we go.
Is it ketamine?
Ketamine and morphine.
Okay.
A little bit of morphine and more ketamine.
What have I actually done to myself?
Well, sounds like you might have put a little hole in your in one of your lungs. Yeah.
Ah, gee.
Let's go another 10 milligrams of ketamine.
Ah.
Still running through. Still good.
Yeah.
Okay, there's going to be some pain here, okay?
Doing really good. Hold nice and still.
Ah.
More ketamine, eh? Please.
Another 20.
Yeah.
They need to minimise the doses of ketamine, as too much can also prove fatal.
Hold still, hold still.
Hold still, mate.
In Mission 3, the team are on high alert after receiving an emergency call-out.
Right, we're off to a private ranch. It's a motor vehicle accident.
62-year-old Gordon Finlay is unconscious and trapped in his vehicle after a high-speed collision with a tree. He is currently being attended to 30 minutes flying time east of Auckland at Hahei.
From the beach a bit at Hahei, there is a private racetrack on a private property. There's some chaps there today with their rally cars, and it seems like one of them's left the track and hit a tree. They say that the driver is still trapped inside the cars, so I imagine it was a pretty severe impact. It's on the nose. See that ridge with that grassy thing going up?
Yeah, it's sort of... And Northcom Westpac 1 located. Roger.
For veteran advanced paramedic Bruce, this scene is all too familiar, and a quick handover from the Ambos confirms his concerns.
Okay. He's just taken a big hit right on his right-hand rib cage above his liver, and he's a bit sore there. Yeah. He was unconscious when they got to him. Right. But he's woken up and been fine with me since. So I think probably he might have a few fractured ribs. The possibility of some liver involvement underneath, I don't know. And he was definitely unconscious. He was blue around the lips. So the plan is just to slide him that way.
Yeah, just straight in here. So, okay, Gordon.
It is still uncertain what the extent of his injuries are, so the team must treat him for the worst possible scenario.
I've got this shoulder. Yep.
We just take the weight, pull the big stretcher out of the road, and then we go. No, big stretcher stays where it is. Stays where it is. We just rotate it around. Okay. So we've got a status 2 patient as a result of a car accident there. He's got a collar on at the moment. He is complaining of a soreness in the chest area.
Bruce fears that Gordon may have broken ribs and internal bleeding.
Whereabouts do you live, Gordon, normally? Tawanui. So he'll be off to Waikato shortly.
Yep.
The team don't have much time and are preparing him for transport. They will need to get Gordon to hospital fast to avoid any further complications.
I'll just sort that out.
62-year-old Gordon is about to be transported to Waikato Hospital.
Can we just get 4 guys on the Mark 11? We'll carry him straight over to our stretcher.
He is in a serious condition after a rally car accident.
So we've got a status 2 patient as a result of a car accident there, and we're going to take him straight through to Waikato Hospital.
Advanced paramedic Bruce Kerr will need to keep a very close eye on Gordon in case his condition deteriorates in flight.
1, 2, 3, lift. You'll have to take very short little breaths because you probably fractured some ribs there.
Okay, good to go, guys.
Yeah.
All they can do now is prepare him for the transfer en route.
And Northcom Westpac 1 located. Roger.
He's had some x-rays. It does show fractured ribs as we suspected. Some internal bleeding there. Yeah, he'll definitely have a hospital stay of a week or so.
"46-year-old Rosemary has had to be stabilised before transport to Waikato Hospital. She She has sustained a major injury after falling off her mountain bike.
She's landed heavily on her right leg, and there is a significant deformity to her right leg, right up tip. I'm just going to lift you across, okay? She's in a lot of pain, and that's been our main trouble trying to get on top of.
After a nerve block and a large amount of medication, Rosemary's pain is finally under control. Dr. David's major concern now is that she may slip into an unconscious state.
So you remember, just keep talking to me and keep talking to us about your pain.
1, 3, 1, 2, 3. Cool. We're all set and secure in the rear.
Okay, cool. We're going to lift and we're going to depart pretty much straight on the nose. It's 18 minutes probably from now.
Afternoon, Waikato LED. This is Westpac Rescue 2. How do you read?
For the team, it's a welcome relief to finally be en route to hospital.
So Rosemary has the risk of either a dislocation or a fracture around her hip area, and if it fractures, you can lose quite a lot of blood into your thigh.
As Rosemary arrives, the team's specialist doctors are on standby. 45-year-old Todd and his wife were celebrating their 12th year anniversary when his quad bike flipped several times. He is in a critical condition. His fractured rib has punctured his lung, and Dr. Rob Gooch must now intervene surgically so that he has any chance of survival.
That's a 99 out of 66 on that side, eh?
97 and heart rate 50.
Okay.
98.
Beautiful.
99. That's it, buddy. Just watch your elbow there for us. All right, mate. Okay. All right. You're doing well. There we go. Hold still, hold still. Hold still.
Good.
Another 20 mgs?
Yep.
Oh, no, 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 no!
Give it a hand,
Yeah. Christ. Oh, they're just, they're just helping your breathing, mate, okay? Oh. Not a pain. Right, they're just helping your breathing.
Okay. He's very sedated right now, so I don't think he's going to remember any of that.
Just as you go up, just watch the rotors. We don't want to get the top.
So the procedure we just did was making an opening in the chest to let out the air which appeared to be accumulating in the chest. That should help his breathing and help some of his pain as well. It's obviously not a comfortable procedure, so we did it under some sedation. He seems to be breathing a lot better since we've done that. He's probably going to need an actual tube in there. He may have a bit of a head injury because he was a bit confused. They'll sort that out, and we'll go from there. From here down, we haven't found anything, which is a good thing, but we'll get some more information when we get to hospital.
Good visibility, moving away.
With the air released from Todd's chest, they're now able to transport him. But the team are extra cautious and fly at a low altitude.
So you want to stay nice and low, guys? Yeah, if you can. Yeah, should be able to.
So this gentleman, as we've heard, has come off his quad bike at fairly high speed and has possibly a head injury, but certainly a significant right-sided chest injury. So on scene, he was having a fair amount of trouble breathing, so we elected to do a surgical procedure to make a hole in the side of his chest and let the air out that seemed to be accumulating around his lungs. We'd had a look with the ultrasound, and it seemed to confirm the diagnosis.
With Todd now at hospital, he will get the care he so desperately needs.
Come on, Bubbas.
6 weeks later, Todd is back home with his wife Nairi, where they both continue to mend wounds from that terrifying day.
Good girl. Good girls.
It's horrific to think that I could have possibly lost him that day, especially on our wedding anniversary. I mean, how terrible would that have been? We have 3 children, and it would have been, yeah, just awful.
And without emergency field surgery, things could have been a lot worse for this couple.
I was told that there wasn't a lot of time left for me. If there wasn't a doctor on board the chopper, basically I wouldn't be here talking to you now. That was a real eye-opener for me. So it could have turned very nasty very fast.
Fortunately, Todd made it to hospital, where the surgical team could complete the wonderful job Dr. Rob Gooch started in the field. As for Todd and a new lease on life, he has other priorities in mind.
As for giving up riding, it's something I've got to look at seriously. I'm self-employed. I do have mortgages to pay, business to run, kids and a wife to look after. And it's, I'm 45 this year, so maybe I'm getting a little bit long in the tooth to pull off these jumps.
Doctors found that Rosemary had suffered a fractured hip. She received multiple surgeries to mend her broken bones. Despite such a high-speed accident, Gordon only spent 2 days in hospital with 2 broken ribs. Both Nairi and Todd praised the ones that helped them on that terrible day.
Thank you so much for bringing my boy back.
I don't think words could express the reason I'm here. Pretty cool thing.